In this busy Toronto emergency department, it's not just COVID-19 bringing people in.
This is a recurrence of repeat vein thromboses.
Dr. Leon Rivlin says after a long lull, influenza is finally back.
Overall, we're seeing an uptake in the number of flu-like illnesses.
That's pushing patient volumes up, all while COVID infections are keeping a high number of staff homesick.
It's definitely putting a big strain on us. There's no question about it.
Millions of Canadians became infected with COVID over the last 2 years, while relatively few people got the flu.
We were able to successfully suppress influenza circulation with our other public health measures related to COVID-19.
But in recent weeks, with restrictions lifted, positive tests for influenza began rising across the country. It's a late start for flu season, yet infections are now nearing typical levels. The question now is what the future holds for flu and COVID. Medical experts aren't sure how these two viruses will interact in the years ahead.
And I think that's going to be very interesting to see what happens as COVID begins to get less and less dominant if influenza starts to compete with it and they have a tug of war over the next couple of years.
Canada's influenza season typically starts in the fall and spikes in the winter. But if COVID waves rise and fall multiple times a year, that could impact when flu viruses strike.
Will SARS-CoV-2 and COVID-19 cases become more seasonal? If they do, we might see a different pattern of influenza.
COVID and flu are both expected to fade as the weather warms up.
And then come the fall, we're going to have this upsurge again. And once again, we're going to be strained for our human resources.
Dr. Rivlin says the upcoming summer lull is when governments and hospitals need to prepare. Lauren Pelly, CBC News, Toronto.